I have some comments that I want to direct towards the way in which public policy is healthcare policy. The backing up, according to the Department of Transportation, the concept of complete streets encompasses many approaches to planning, designing, and operating roadways and right-of-ways, with all users in mind to make transportation networks safer and more efficient. That's the bottom line. Public Works is already doing or trying to do complete streets planning now, as you already suggested yourself, Mayor. For example, we have a sidewalk fill in the gap program. Having a resolution is merely a step towards a firm decision to design streets for people now and in the future. Why should we care about this? According to the Centers for Disease Control and Prevention, 77% of Americans don't get enough exercise. Now, a new study at Cleveland Clinic by Dr. Wael Jaber shows that not exercising poses a greater risk to one's health than smoking, diabetes, and heart disease, the major killers. Dr. Jaber explains the issue this way. If people had health insurance policies that did not allow them to buy blood pressure medicine if they had high blood pressure, or cholesterol medication they need to save their lives, then people would be up in arms over that. However, if a community decides to design itself so people cannot casually walk around, people do not think about this as a public health issue. Jaber states that we should demand from public officials that we design communities that are conducive to longevity, conducive to physical activity. He says this is one thing we can work on as a community rather than as individuals. What does local government do? It makes decisions about quality of life and puts in place policy that shapes the community. And therefore, I become baffled when people speak against that very premise. So public policy is healthcare policy. Healthcare policy is the most expensive thing we have going. We are acting responsibly when we address this, when we plan for it, and when we do it.
Thank you.